Okay, sorry. Tonight, we're going to be talking about the Kansas Special Healthcare Needs Program. It's an amazing program that is at the Kansas Department of Health and Environment through the Kansas and Maternal and Child Health. Kayzy Bigler is our speaker. I just want to give you a couple of quick tips. That if the PowerPoint is down and your video is on, you will be seen on Facebook because we are live on Facebook. And also this session is being recorded. So just want to give you a heads up for that. You can put all of your questions in either the Facebook chat or you can put them into the chat box here on Zoom. And I'm going to turn it over to Kayzy.
Thank you, Stephanie. Thanks for inviting us to share about our program. We're very excited to be with all of you today. As I go throughout, if you would like to ask questions, you're more than welcome to, but we will also leave some time at the end for additional questions there as well. So I'm here today to tell you about the Special Healthcare Needs Program. It is housed.
I'm sorry, can I just interrupt? I completely apologize. I thought our guests were in already and they weren't, so I just wanted to admit them. I just want to reiterate, I apologize. We are recording this tonight and also we are live on Facebook. So when we are live on Facebook, if the PowerPoint is down and your video is on, you will be seen. So just be mindful of that if you don't want to be seen on Facebook. And it is being recorded. And again, we have Kayzy Bigler with Kansas Department of Health and Environment talking to us about Kansas Special Healthcare Needs Program. Now I will stop, Kayzy.
Okay, are you ready for me to go ahead, you think? Okay. Okay, well, thank you all for letting me join you this evening to tell you about the Kansas Special Healthcare Needs Program. We are a program within the Kansas Department of Health and Environment. We live within the Bureau of Family Health. So we're very excited to share with you all about our program, and please pass the word to other families that you know that maybe could take advantage of our programs. I'm going to go through and I'm going to share our main category areas with you that we provide services to families under. And some of these are things that meet medical criteria or financial criteria, or there's no criteria at all other than to have a child with a disability or special health care need. If you have questions as we go throughout, feel free to put them in the chat. Stephanie, if you kind of monitor the chat and let me know if there's questions there, or if you want to unmute and ask the questions, that's fine as well. We will leave some time at the end for your questions. And I'm always happy to have questions. If I don't know the answer, I promise I'll find it out. So if you go ahead and advance my slides. Okay, so today what we're going to cover is I want to give you an in-depth overview of the Special Healthcare Needs Program. It's one of my favorite topics to talk about. So no, I could go on forever, but I will watch my time. I do want to tell you about the Family Advisory Council because I am a family member of a child with a disability myself. And so I know how important that family voice is and that family choice. And so everything that we do with the Special Healthcare Needs Program is done with that in mind. We go back to the families and we get input from the families, and our Family Advisory Council is one way that we get a lot of input. So I do want to share with you about that. And then I also want to share with you our connection to other Bureau of Family Health programs. Special Healthcare Needs, of course, is one program among many. And there's a lot of things we do, but we know, as with anything, we're better when we partner and collaborate with others. And so I want to share with you kind of how that collaboration works here at KDHE. And then, of course, at the end, we'll save for question and answer. So with Special Healthcare Needs, the program purpose really is to promote the functional skills of persons who have or are at risk for a disability or chronic disease. This has been our program. We have been in existence since 1935. We have undergone numerous name changes, but Special Healthcare Needs is kind of the name that we've had at least for the last 8 years that I have been here. And we are there to really provide a variety of assistance to families. And we'll go into each one of those things in subsequent slides. So the first thing that I want to talk about is the target population definition. So when you hear me talk about special healthcare needs, I kind of use disability interchangeably with that because it's a global thing. There's a lot of different disabilities that fall within special healthcare needs and that fall within the national definition. So when you look over on the left side of your screen, you'll see, or on your right side of your screen, I'm sorry, you'll see the Maternal and Child Health Bureau definition. Children and youth with special healthcare needs are those who have or at risk for a chronic physical, developmental, behavior, or emotional condition, and who also require health and related services of a type or amount beyond that required generally. This is the definition that our program is slowly migrating to over time, and you'll see that when we talk about some of the services that we provide. However, we do follow state statute. So you can see it, it's KSA 6-5A01. And that says a child with special health care needs means a person under 21 years of age who has an organic disease, defect, or condition which may hinder the achievement of normal physical growth and development. So we will talk about all of the different state statute specific conditions that we cover, but know that we look globally too. So some of our services are strictly along that state statute line and others are more along the Maternal and Child Health Bureau line. We do provide services to those birth to 21 with specific health conditions. And we also provide metabolic formula for those over 21 who apply and meet the financial criteria to be able to get their metabolic formula. So the core functions of special healthcare needs. Special healthcare needs is a very diverse program. Stephanie could tell you we're kind of into a lot of different things. There's a lot of things that we participate in, but there's 5 key categories that I really want to make sure that you all know about, and please share wide with everybody. But the 5 core functions of the special healthcare needs program are diagnostics. And again, that's an evaluation and related tests. It's not meant to be a second opinion. So if you've had a first diagnosis and you didn't agree with it or whatever, we can't do a second, but we certainly can help you out with that first diagnosis as far as paying for it. Always, if there's insurance, the insurance would be billed first because we're payer of last resort, but we can sure help you set up an appointment with a provider and authorize that. And then if your insurance doesn't cover all of that, we can cover the remainder. So we do provide the one-time diagnostic. This is something that is really underused a lot, but we do have funds there to do that. Then we also have what we call our direct assistance program. We call them DAPs for short. And these are client chosen funded assistance programs. We have 8 different ones. I think we might be adding a 9th one that we're pretty excited about, but we haven't made that final decision. So as with anything with these slides, everything is subject to change. We look to improve things over time and really hope to be able to reach more children and families by expanding some things. So keep in mind that a new DAP could be added. We usually make changes to the program every July. And we don't usually take things away, we just add. So that's kind of exciting to see happen. With our direct assistance programs, you do have to meet both medical and financial eligibility. I will back up with diagnostic. There is no criteria. It's you have a concern about a child's development. That is criteria enough for us to provide a diagnostic. So that is open to anybody in the state. You have to live in the state of Kansas. For the direct assistance program, again, it's medical and financial eligibility. Our application is about a 5-page application. And when I say that, most of it is just basic demographics and then a release of information to communicate with your providers, that kind of thing. There's nothing really difficult about it. We do ask for your most recent check stubs so that we can calculate financials. We do not, if you've gotten a bonus at Christmas time, we do not hold that against you. We do not hold overtime against you because we know that that is something you don't get all the time. So we take your base core salary, and that's what we base it off of. And those are for the adults that are responsible for that child in the household. So if mom and dad both work, we'll take both incomes. If only one parent works, then that's what we take. Also, I want to mention too, with the financial component to qualify for our program, and we'll get into a little bit more of this, but individuals can also qualify for our program through being an SSI recipient. So they might not meet medical eligibility, but they have SSI. Again, that's a qualification for our programs. They would not, if they have SSI, qualify for the direct assistance programs, but they would be able to qualify for everything else. With the direct assistance program, it's really based on a client's needs. So let's say somebody has no insurance. They could take advantage of our medical service staff, or they have insurance, but they have really high copays and deductibles. So they need our copay, deductible, and co-insurance staff. Or travel is an issue because they live in a rural area and they have to travel to Kansas City or Wichita for all their services, and travel gets expensive. That could be the DAP that they take. They could take a durable medical equipment DAP. If they need a wheelchair or some kind of lift device or a walker, those all qualify. I'm trying to think, we have a caregiver relief DAP, which is really nice because a lot of families on our program have waivers and they get some assistance sometimes with caregivers, but sometimes it's just not enough, right? Like sometimes those caregivers go to school with that child, or are used so sparingly, and they just need some extra time to go to their own medical appointments, or mom and dad need a date night, or mom just needs to go to the grocery store by herself, right? We do provide the Caregiver Relief App, which is one that we've been very excited to be able to offer. And it's not meant to replace anything to do with a waiver. It's meant to complement what a parent already is receiving for their child. I'm trying to think of all the DAPs, and I should have had my list out, but medication is another DAP that we offer as well, along with a few more DAPs too. And we're looking at doing some fun things around transition. So I'll just give you that sneak peek, but nothing has been formally put in place yet with that, but we're very excited about our direction.
Can I ask a quick question?
Sure.
On the DAPs, you mentioned the income of the parents. Is that both parents if they're not living in the house? Like if it's just mom and the child, do you just use moms, or do you get dads too?
It depends on custody situations. So if it's a joint custody situation, we get both. So we look at it on an individual basis. Also, if a family is self-employed, we look at their self-employment income, their profit and loss statement for the last few years or last few months. So we have different ways that we can calculate that. If they have food stamps or SSI, we do calculate those in because those help. Or if there's child support, like let's say it's a single mom and it's mom has full custody and dad, sees child on occasion and pays child support, we would calculate the child support and mom's income in that situation. So we try to be very flexible and work with families as much as possible, but we're very consistent with what we do because we want it to be fair and equitable. Okay, so for care coordination, it's very exciting. We call this our holistic care coordination because we don't just look at what happens medically. We know that when we're talking about children and families, it's about the whole family and the whole child. And so that means that we need to look at what's going on with that family and child that could be a minimal barrier even to the child getting all the services that they need. And so we look at things like education. We look at the medical aspect, of course. We look at things to do with legal. Maybe there's some guardianship that needs to be happening and families don't know about that until, maybe that's close to that child turning 18 and now we're in a panic. So, things like that can come into play. We also look at the social, what are the social components of that child and family and how can we help strengthen their their role in society, right? We also look at financial. What are the financial barriers? Is there housing insecurity? Is there food insecurity? Do they have a support network around them? What does it look like that we can support them in and help them? And care coordinators, through this holistic approach, and I just have to brag on the team. Like, we have such a fantastic team of care coordinators that I couldn't be prouder to work with them. They are amazing people. And I hear kudos from families all the time about the hard work that they put in and how supportive that they are to families. And they work very closely with the family in a partnership. It's not about us doing it for families or telling families what they need to do. It's about a partnership. And they really form those partnerships, and they help work with the families to develop action plans if a family wants one. So kind of that next step in the process of something they want to do. So a really good example of that would be, let's say that there is a youth and they are of that transitional age. Let's say that they're, 12, 13, and we want to start thinking about what's life going to be like when they're an adult? What can they do for living independently? And so it's planning for those steps. It might be, we need to teach them how to just carry their insurance card and be responsible for that. It might be teaching them how to order their own medications, or how to understand their medications, or how to tell what their disability is and explain it to others and advocate for themselves. It could be planning for college and getting connected with the resources at the college campus for special needs. So there's a lot of varieties. It could be looking at housing situations or work programs. So the care coordinators really help with a lot of varieties from birth all the way through. So it's about the life course. We look at transitioning, things happening from the day that baby's born. There's always things happening that we need to be able to help families with, because parenting doesn't come with a handbook. And so we're navigating it. And so care coordinators have learned how to help navigate, and they can help families do that. And they're really good at understanding the community resources and being able to link families there where they need them. Care coordination, we have been so blessed and so excited. Care coordination was, you had to meet financial and medical eligibility. And we have now made it so if you meet medical eligibility, you are entitled to our care coordination. You are eligible for care coordination. And so we're super excited about that. And we want a lot of people to take advantage of that. And again, families, if they feel like they don't need care coordination, they can decline it, but it's there for them. And they've always got that person to call and lean on and help them with anything that they need. Special Bequest is another service that we're able to offer through a trust. A family many years ago gave us a trust because their child had been on the program, and they had been appreciative of what had happened while the child was on the program. And so therefore they leave us some money each year from their trust that we can then spend to help other kids, thinking outside the box, thinking further than just what our direct assistance programs are able to do. So it's really exciting because we've been able to help with home modifications, with car modifications. We've been able to send kids to camp for special needs who never were able to go before. We've been able to send parents to trainings to learn more about their child's special need or disability, that they've wanted to go to a conference and couldn't afford the fee, the registration fee, and we pay for that. So it's a simple process, but so helpful for parents when they can take advantage of that. So Special Bequest is made up of 5 commissioners, and 4 out of the 5 are parents with children with disabilities, and 1 is a developmental pediatrician. And those meet quarterly with what happens is our staff presents case scenarios to them on different children who are putting together, or families who are asking for special things through Special Bequest. The care coordinator works with them to identify what it is they need, why they need it, get the doctor's note stating it's needed, that kind of thing. And then they put it before the Special Bequest Commission, and they discuss it and they approve or deny. Very rarely do they deny. A lot of times they'll come back with some additional questions that they want us to check into. But they more than likely will approve things as long as it's reasonable. And it really gives, it's really about the life, the quality of life instead of the quantity of life, right? And if we can make the quality of life better, that's what counts. And that's what Special Request allows us to do. So it's really exciting. And all the commissioners that are on there are all about the quality of life. So it's a great group of people. And I really always enjoy those quarterly meetings. If we have special requests that come up in between things, we then do it via email, or we'll call an emergency special request session. And they're always very willing to hop on to a conference call or a Zoom meeting to have that. And the commissioners are appointed by the governor's office, and they live all across the state of Kansas. So they understand our rural, frontier, urban lifestyle that can play a role in how people are able to actually get services. So special request, they do have to qualify for our program. The caveat here is if they have SSI, they don't have to medically or financially qualify. SSI is an automatic qualifier for special request. Otherwise, it's medical and financial qualifications. So that's kind of another little way that you can kind of qualify. The other thing that we're very excited about, and unfortunately, we've kind of had to put it on hold because of COVID, and we just can't wait to get it started again, is our family system navigation training. This is a one-day training. And again, this is open for anybody and everybody. So anybody that's on this meeting today, let us know. We will come to your area. I know we partnered with Stephanie before, and we did one in Kansas City. We travel the state and we do these, and it's a one-day training. So families come for the day and we provide them lunch. We provide them all the supplies. It's an interactive hands-on, but it's also a support system. You really start supporting each other, and it's a fun day. And it's presented by myself or other staff who have children with special needs. So we get it firsthand. We don't allow any staff people to participate in these trainings that have not that don't have a child with special needs or a disability, because they don't get that firsthand. Not to say that they're not compassionate and they wouldn't do their best, but we know families do better talking to another family who kind of gets their journey, right? At the end of the day, we do a pre-assessment and then we do a post-assessment. And at the end of the day, we take those post-assessments and we come back and issue them a $100 stipend for their participation. We are hoping to get that changed back to gift cards. At one time we were able to do gift cards and then they kind of went away. And there's been some talk about having the gift cards back again. So I need to do some more checking into that, because it's really nice to walk out with that $100 Visa gift card that you can then turn around and pay your babysitter or pay for your gas. We do these all across the state, so in the hopes that no family would have to travel more than about 100 miles to come to one. So if you would like one held in your location, please let us know. We need to have a minimum of about 15 families. We can have as many as 20, but we really try to limit it to that many because we want everybody to have that interaction. We want everybody to have a voice at the table. So we do limit it. We are doing a trainer of trainers with that. So I am training other people to do this. So it's not just a me, because it really takes two people to do, so we can hand off. You'd get tired of listening to me talk all day. And so we have that happening as well as we're translating it all into Spanish and have put all the slides and everything in Spanish. So we are going to be able to offer it in Spanish here as soon as we can all get back into the real world and face-to-face. We are considering some ways to do it virtually, but it just doesn't quite have the impact as in person when you can laugh and giggle with other people. Again, like I said, that is open to everybody. And like I had stated before, all of our services are eligible for those from birth to 21. So I just want to kind of recap really quick, because these core functions are so important and I want you to know the criteria, eligibility criteria for them. Diagnostics, absolutely anybody. There's a question about any kind of special need and you need a diagnostic, let us know. Direct assistance programs do require an application be completed and the client must meet medical and financial eligibility for those. Care coordination, they only have to meet medical eligibility or be an SSI recipient. So while autism is not a condition per se that we have on our program, if they have SSI, care coordination can happen for them, and we're happy to do it. Special bequest is also like care coordination. It's medical, SSI, or medical financial criteria. Family systems navigation training, those are open to anybody and everybody as long as you're a Kansas resident. Okay. So here's our eligible conditions. Spina bifida, cleft palate, congenital heart disease, burns, orthopedic conditions, gastrointestinal, hearing, vision, cranial, facial. So like cleft lip, cleft palate for that, seizures, juvenile rheumatoid arthritis, and genetic metabolic conditions. And those are the genetic metabolic conditions that are screened through the newborn screening program. And there is a very long list of those. There's over 30 of them. It says 29 here, and I didn't update that, but they have expanded and continue to expand. They're expanding with a new one as we speak. So this is an ever-changing group. So I would encourage you to get on the KDHE website and look at newborn screening, and you can see all the conditions there listed, or you can go to the special healthcare needs part of KDHE and find it as well. So we do have a wide variety of conditions that we are covering. And again, we look at what is the need and go from there on what we help with and how we can assist. But you can be on our program and maybe the child has hearing loss, but yet there's help that they need with their education or with other things. We can help support that as well. Okay. So here is our current satellite office map. I just wanted to kind of give you a little bit of an idea of, I didn't state before, but we have staff here in Topeka office, as well as staff statewide in our regional centers, because we know that providing support and services in an area that you know best, you know the resources, is the best way to do it, where somebody can come into your office and sit down and have a conversation if they want. And so we have satellite offices all across the state. We will be looking probably to have some conversation maybe with a couple other sites to see if we can't expand some sites that have some Spanish speaking staff. We do have one Spanish speaking person in the NEO show, so that is in English and Spanish, but you can see according to the map, the service areas that they cover. Here in Topeka, we have 3 Spanish speaking staff. Our lead care coordinator speaks Spanish, as well as 2 others. And then we have somebody that specializes in genetic metabolic. So that's really helpful too, because she has a lot of knowledge on the genetic metabolic conditions. So those are there, and they support the satellite office staff as well as work with the patients themselves here. So you can see all of our counties. And if anyone is interested, the applications are online. You can fill out an application and you can send it to the county nearest you. Meade County currently is not an active satellite office only because of COVID, because they've been swamped. And so Topeka, Shawnee County is covering that region right now as far as applications and stuff until they're able to come back full force when COVID kind of slows down for them a little bit.
Kayzy, we had a question on Facebook.
Okay.
Is Rett syndrome covered? It's genetic condition, but not from a newborn screen.
So with Rett syndrome, a lot of times there's secondary conditions. So I love that question. Thank you for asking that, because it takes me to a place I didn't go and I should have. Rett syndrome in itself is not covered. However, many times there are secondary conditions that are covered. Maybe a hearing loss or a significant vision loss, or something to do with the heart. It depends on the individual child and their overall condition. So we would request medical records and really review. We recently have had somebody with Rett syndrome, but they were covered because of a secondary condition. Any other questions? Okay. So when we think about special healthcare needs, we did do a needs assessment many years ago now. I shouldn't say many, but it feels like it. We've been working off of this needs assessment for about 6 years now. But we really identified, and this was a very intensive process. I think Stephanie, I think you were even involved in this when we did this. But we came up with 5 core areas that everyone was saying, and this mostly was from parents, saying these are the areas that need to be covered. Care coordination, of course, always came out number 1. And what we kept hearing is, we don't need another coordinator. We need somebody to coordinate all the coordinators. So when I talk about holistic coordination, I mean that our care coordinators will work with all other providers to help get it coordinated. They work with CanCare. If a person has CanCare and they have a case manager or somebody there, we work with them. We collaborate with them. So there's no duplication in effort. We'll work with the schools. We'll work with the infant toddler programs. We'll work with childcare and community housing or whatever. We will reach out and help make those connections with you as a client. Behavioral health, of course, behavioral health was huge then. Now with the pandemic, I think behavioral health is even bigger. And so we always keep that in mind, and we always make sure that we're helping families make those linkages where and when it's needed. Training and education came up. It was not only just training for staff and making sure that we were training our staff to be able to really be responsive to all the parents and clients, but also that we were providing some training for parents. Like I said before, parenting doesn't come with a handbook, and we don't know what we don't know. I can't tell you how many families I've talked to and they didn't know about waivers, and they didn't know about SSI. They didn't know where to reach out to for any kind of help. And we're able to connect them. We're able to share with them the different resources in their area to help connect them with CanCare, with SSI, with waiver services, with all of those types of things. The direct healthcare services, that's how our DAPs came about. What we were doing before just wasn't effective. Like, things had changed. CanCare had come about. Our program was in effect way before CanCare, and we didn't change and modify with that, and we needed to. So that's where our direct assistance programs have come out, and we've been able to really gear those and modify those to really meet the needs of the individual. It's really exciting when we can say, here's a list of everything we can help you with this DAP. And we send that to families. Like, they know, if I've picked medication DAP, here's what I get. If I've picked medical service DAP, here's all the things that are covered under that. Medical equipment, all of that is covered under what I've chosen. So you can really customize the DAP to be, or the DAPs to be what you need them to be. And then the last thing was the family caregiver health. That is something that we continue to strive for and continue to work on even more. I mean, all of these continue to be happening. Once we get a good handle on something, we don't just say, okay, it's done. We keep improving it. We keep moving it forward. So a really good example of that is care coordination. We have a great care coordination system in place, but now what we're doing is we're expanding that. We're adding more transitional things to that to help with those adolescents that are in their youth, and really working with them to help them be prepared to be an adult. We're also expanding to a new, what we call holistic care coordination with providers, and helping providers now get care coordinators within their office, because we want this for all children with and without disabilities, because it's been effective, right? And I will tell you that the data that we have taken on care coordination, families have actually improved their ability to navigate the services, the systems of care by 85% from the last year to this year. So we've tracked it each year, and it just continues to grow. So that's really exciting to us. We were hoping for a 5% increase, and to get an 85, we were really excited. Family caregiver health, we're always so cognizant of what is going on with the family. A really good example is, let's say a mom delivers a new baby, and baby has been identified with a genetic or metabolic condition. That's really hard for a mom to understand and wrap her mind around. And that can really help to lead to postpartum depression. We know that if mom's got postpartum depression, we can't get her to get the baby to all these specialty appointments if we need to get mom's mental health under control first, right? We need to help mom. Like, we need to make sure we're getting her linked where she needs to, so she has the support she needs to be healthy too. So we don't just look at what's good for the child, but we look at what's good for the whole family. And by doing that, we know that that also is what's good for the child, right? If mom and dad are healthy and happy, baby's healthy and happy, siblings are healthy and happy. And that's the goal. It's about building better families and better generations, because we really do look at what this looks like 20 years down the road. Now we've got healthy, happy children that are productive adults and can have productive families. Okay, so we're going to look at each of these individually. So with the care coordination, I've really talked a lot about this. I've probably made you all crazy. This definition that you see here, the patient and family-centered approach, I'm not going to read that because you all can read that, but that was actually developed by our Family Advisory Council. They are the ones that came up with the definition. And they also said this is the highest priority and that they wanted it to be a holistic approach. We did engage the MCOs, the managed care organizations, or CanCare, right from the beginning and said, what are you doing? What does that look like? And then worked off of what they said that they were doing to make sure we were filling all the gaps. And we have actually a shared report that goes back and forth between us to make sure that we're meeting all of those needs. Excuse me. And then the action plan. We develop an action plan that really is, I always have the saying, you can't eat the elephant one bite at a time, or can't eat the elephant whole. We have to eat it one bite at a time. So the action plan really is breaking those down into those minute steps. So let's say that we're suspecting that something's going on with a child, that maybe we're thinking that there's some seizure activity, but there hasn't been a formal diagnosis. With this, we can actually break it down into steps of, okay, let's get the appointment first. Let's make the list of questions for the doctor. Let's help mom learn more about what seizure disorder is. Those kinds of things. We can break those down so mom and dad both feel comfortable with what's happening next. And we can have time elements. Maybe it's our care coordinators are going to do some research and get back to the parents. That's perfectly okay. That's what we're there for. Okay, if you want to go ahead and change, Stephanie. Okay, behavioral health. So again, this was a high priority. And I was not surprised that this was a high priority, but actually for some staff, they were surprised it was. But it is a new territory for special health care needs. We never really got into behavioral health. And when I came on board, I said, but how do you separate physical and behavioral health? You can't. That's like saying, education and health are two separate things. No, you can't go get an education and you can't learn if you don't feel healthy, right? So it all comes back to the same thing. We have to have a combination of a healthy balance. And so behavioral health, again, this definition was done by the Family Advisory Council, and it was identified as a high priority. And it's really been about engaging health providers and really learning more about what we can do to help increase the behavioral health. And here at KDHE, I think a lot of it stemmed from a lot of the work, or I'm gonna say special health care needs is gonna take some credit for it. Might be wrong. This is just my opinion. But we now have a behavioral health consultant who was hired because the Bureau in itself, on our visionary, Rachel Sisson for our Bureau, really understood how important behavioral health was to the overall health. And so now that we have this consultant in place, we have come up with all kinds of different things that have been able to happen within KDHE that really is so wonderful for kids and parents. But we really have engaged with a lot more behavioral health providers and really helped with that referral process and encourage a lot of assessments to take place. We've also supported behavioral health through telehealth services. And with the pandemic, I will just say telehealth services have been supported by everything to do with the Bureau of Family Health. So we will continue to support that because we know that that's another way to get those services when you can't in those rural areas. Family and caregiver health, again, that holistic approach like we talked about to address the program's participants' needs and focus on meeting, again, that whole family, that physical, that emotional, everything. If you have a healthy parent, you're going to have a healthier child, right? And again, that parent needs to be physically and emotionally healthy, healthy and happy. That's what we want families to be. And so we really have been looking at developing a method to assess needs. We do have something that we put into the works, but we haven't gotten it finalized yet. That's something we're hoping to get done here very soon, where we can actually kind of let families do a self-assessment, and then we can help guide them based on their self-assessment on where maybe they can get a little bit more help. Maybe it's they need to have some counseling, maybe they need to have some yoga, maybe they want a support group. Like there's all kinds of different ways that we can address caregiver health. We just sometimes have to think outside the box. And I have to say in this program, and if you're a parent with a child with a disability of any kind, you think outside the box. We learn to do that. And so with this program, we do that. You can see again, all these definitions are Family Advisory Council definitions that I'm very proud to be part of. The direct health services, as we talked about, the direct assistance programs, I said 8, I'm sorry, it is 9 direct assistance programs, hopefully to be 10 very soon. And those all are there to, we have changed those throughout. We've added, Caregiver Relief was a newly added one. We re-looked at how we were doing medical services. So now if somebody doesn't have insurance, medical services, we realized, you know, when you think about holistic and you think about having the child be healthy, they need to have their well child check, right? We shouldn't just be paying for specialty care, but we need to be paying for that yearly well child check. So we pay for that. So there's things like that now that are in place to just try to be proactive with the child's health. We're really trying to look ahead to make sure that we can keep the child healthy and out of the hospital and out of the ER as much as possible. Again, a lot of support for a variety of community providers. We have a really long list of providers who work with our program. We try to turn around and reimburse as quickly as we can. And that I think helps keep them loyal to us. And we try to be really quick with our authorizations so they know that that service has been authorized and that family will get supported. Some of those other direct assistance programs like medicine, a lot of times medicine just can be very, very expensive and families can't afford that. And this is a way that we can help. Maybe you have insurance that, you know, helps with that, but you need the copay deductible to help pay some of that other part of your medication expenses or your deductible when you go to the doctor. We have that one as well. So there's a wide variety of things that our direct assistance programs can help with. And if you'd like to see the whole list, I probably should have had a slide that listed them all. But it is on our website and you'll get the link here at the end. And I think Stephanie will send that out as well too. We also have specialty clinics that we support that include outreach clinics. So we're really excited about what they do. We actually did a return on investment on our outreach seeking clinics and really showed the profit that the cost savings to society that it held. And it was actually $961 per client was the saving cost because they were able to actually have those clinics come to their location versus the family having to travel. We also, of course, continue, as I said, to support telehealth. We support all facets of that and work with providers to make sure that that's happening. We even have provided some telehealth equipment to some of our satellite offices in the past to help them be able to support that. And again, the definition written by the Family Advisory Council. So training and education. The family care coordination training's name was changed to the family navigation training. I guess I did not get that changed, but we continue to do those. We've done those all across the state. And as I said, we continue to expand those and have even greater thoughts in mind that will be coming up in the next year, again, around transition with that too. Lunch and learns for providers. You know, sometimes it's surprising to us. Providers are just like us. They know their specialty, they know their area, but they don't always know all the resources and stuff. And so we've actually done lunch and learns for providers and shared with them about things like waivers and about community resources. And it's always amazing how they don't know that some of those things are available to their families that they work with. And so the more that we can work with them and learn from them and help them learn from us, the better we are. So we try to do that during their lunchtime so that we're not taking up a lot of time, but those have been very beneficial. Oh, could you go back just one more? Sorry. We also really work with the MCH, the Maternal Child and Health program. So we're going to talk more about that, but we really work with the workforce to understand the specific needs of children and youth with special healthcare needs. We have a strong philosophy that a child is a child first, and the fact that they maybe have a special healthcare needs is a secondary thing. They still need all the same things that a child normally needs. They need to be fed, they need to be read to, they need to be played with, they need to have their baths, they need to have their education, they need every single thing that you would do with any other child, they need to. And I know when I first started here, this was a very siloed program, and it's not anymore. Other programs are looking at that. So when you talk about the maternal child and health and all the services they provide all the same services for children and youth with special health care needs. So it's very exciting to see that happen. And again, includes family and youth advocacy and leadership development. So we're always working to help strengthen our leaders, whether it be through the Family Advisory Council or the Family Consumer Partnership Group. We're always working to strengthen the advocacy and leadership from others.
Kayzy,
And I will just,
go ahead, finish.
I was just going to say, when it comes to advocacy, I will tell you, I have advocated here locally and nationally. And when you advocate, if you advocate wearing a professional hat, you don't get near as far. But if you advocate wearing your parent hat, they listen to you. So don't ever be afraid to advocate, whether that's in your local community because you need a new playground that's accessible, or you need the school to put in a ramp, or whatever it is. Don't be afraid to advocate for what your kids need. You are your child's best teacher and best advocate. They need you to speak for them, and it's okay to do that. And so, you know, when it comes to advocacy, like, we can't advocate here as a state agency. I have to say that's the hardest part of my job. I love to advocate. I like to scream it from the rooftops of what's needed, and I can't do that, but I can tell you how to do it. So if you ever want to know, you know, some things to do to advocate, I know Stephanie's really good at it too, but please feel free to reach out to us. We're happy to give you some points and tips on that. And we're also happy to provide data if we have the data available that you would like to have information on, aggregate data to be able to share to get your point across to legislators or community leaders in your community or your school district, or just even your doctor's office. We're happy to provide that. Okay, go ahead, Stephanie.
Oh yes, I love advocating myself, and sorry, my dog's barking in the back, but you know, working at KU, I also cannot advocate and do all that I want to do. But I just had a quick question on the lunch and learn for providers. Do you have to have a minimum number for that, or can, like, because I know, like, for the family trainings, you know, we say at least 15. So
the family trainings we do because we give stipends and that kind of thing. For the providers, no, we've done them as groups as small as 6 or 7. Okay. Yeah, no, it's whatever we've done. And we've done a lot of ground rounds and things like that too.
Just want to let them know if they are hearing this. Ask that for you. So.
Nope, invite us. We're happy. Okay, so our specialty and outreach clinics. And you know what? I realized after I did this, we do have a new contract with a group in Wichita that is really focused on autism and focused on helping with some assessment process and teaching infant and toddler individuals how to do some of those, getting some of those assessments done so that it can move the process along for the final diagnostic. So there's some work going on there too, and I forgot to include that because it's a fairly new contract, but we're really excited about that and where that's going to go. We do have a medical complex clinic in Wichita that is kind of a one-stop shop. They can go and they can see 7 or 8 doctors. So sometimes when we have a child in that area that needs a one-time diagnostic, this is where we send them. It's a great group of people. We do have the social worker there that also works with us in the care coordination. So she does that with the clinic patients that attend clinic. She's kind of the care coordinator. That's kind of our outreach arm. But we're really excited about what that looks like. There is a PKU clinic in Wichita as well, where all the clients for PKU can go and really receive some services. And then there's the wheelchair seating clinic with CPRF, Cerebral Palsy Research Foundation. And they do a phenomenal job. And I will tell you, these outreach seating clinics that are listed, have changed, but I did not remember the location and I did not get a chance to look it up. These are the basic ones, but I think we added another, they have added a couple more or one more location. And so they go and travel to these cities so that families can come there and meet with them. So it's not the hardship of the families traveling. Especially when you've got a child with special needs. You guys all know how hard that is for them to travel long distances, especially with those physical disabilities. And this makes it so that they're more comfortable in their more natural environment. They don't have a long trip. The wheelchairs all the measurements can be taken, all of that can be done, and the wheelchairs can be delivered to them later, or modifications can be made. And the people that are with cerebral palsy, I can't say enough about the clinic partners. They're fantastic and they do a really good job. So, you know, we always know that they're in good hands when families go there. So our newest, because I can't ever stop coming up with other ideas. And one of the gaps that we recently identified, well, I guess about 1.5 years ago, was that a lot of kids, when they get infant toddler services, and infant toddler services are that birth to 3 service that kids with any kind of a disability, if they've got a developmental delay, or they were born prematurely in the NICU, or certain conditions, can qualify for the infant toddler program, or it's called Tiny K. Depending on where you're located, it goes by lots of different names. We are working to brand it to make it so that it's more universal and everybody knows what it is. But we've found that when the kids transition out of that program at 3, a lot of times parents are just so lost. They don't know where to go. They don't know kind of where to turn. A child may qualify for the early childhood special education program in their school district, or they may not, because the criteria is so much more stringent, right? And so we got to thinking about how that's such a gap for parents. Plus, when you go from the infant toddler program, which is family-oriented, family-centered, to the school program, which is child-centered, child-based, families just kind of feel like they don't have as much power, right? And so we really got to thinking about what that looks like for families, and being a parent that went through that, I get it. And so we came up with what we call Bridges, because it seemed like the best name for it. And it's really about a collaboration between the Kansas Infant Toddler Early Childhood Program and the Special Healthcare Needs Program, which I am the unit director for both of those programs now. And so it was easier for me to bring that collaborative partnership together. But both of these programs are now working together for the Bridges program. And the mission in this program is, in collaboration with the Tiny K, the Special Healthcare Needs Program will provide holistic care coordination to transitioning children and their families to assist them in navigating complex systems of care for a smooth and stress-free transition experience. What happens in this program is we're piloting right now, and we have 6 locations across the state that's piloting. Some are rural and some are urban. But what we're doing is we're piloting, and some of them, we even have Spanish families involved in this too. So we're piloting with Spanish families as well as English. And what we're doing is, when a child is getting ready to graduate or turn 3 from the infant toddler program, the infant toddler program can then refer that family a couple months prior to their 3rd birthday to the Bridges program. All it takes for criteria for qualification is a referral. We don't care about the condition. We don't care about financials. The application is literally like a 3-page basic demographic kind of application and a release of information. At that point, the care coordinator then enters all the information to the data system, reaches back to the Tiny K provider and says, I got the application. The Tiny K provider then holds an introductory meeting between the family, the care coordinator, and themselves, so they can talk about the type of services that the Tiny K providers have been giving them, what the needs of the child and family are, what the next moves are that they would like to see. And that care coordinator will then begin working with them. That care coordinator, as long as they renew their application every year, that care coordinator can work with that family up to the age of 8. So that gets them not only past the early childhood, but past kindergarten and into the grade school level, to where families are a little bit more used to all those changes. We're very excited about the enthusiasm from the infant toddler programs for this and from parents. And again, it's our special healthcare needs program staff that has been doing this, our care coordinators. But we added some extra training on there to help them know more about the education component and IEPs and family rights and that kind of thing. Again, they're not experts in that, but they have the knowledge to know where to go for more help, such as Families Together, and to be able to explain things to the parents when they go, well, why am I signing this paper? Or what does this mean? So they can help them understand some of the paperwork. So we're very excited. We're in the second year of this. We've got everybody trained, and we are now welcoming families onto the program and having some really great excitement around it. Okay, before I tell you about the Family Advisory Council, I was thinking I had a slide just on the finances, and I think it was in one of my others and I skipped over it. I do want to let you know the financial component is listed on our website, but I will tell you that we have spend downs. We have some people that maybe don't qualify at the beginning of the year, but then they have so much medical expense for the whole family that they have spend downs that qualify later in the year. I would say, if don't hesitate to fill out an application, send it to us, and let us determine the financial eligibility. A lot of times families don't apply because they don't think they're going to qualify. And then all of a sudden they do, and they're like, how did that happen? Well, because there's things that we don't count that maybe would have been counted with CanCare or with another entity that you're used to working with. So we really try to make it as family friendly as possible. I will tell you that all the conditions that are not genetic metabolic, a family would need to qualify at what we call 185% federal poverty level. That's something that the federal government sets every year. And we do have a certain amount that can come off for, extra things that you have, like in savings, that kind of thing. You have so much of that can come off as well. But we have that for families that qualify at 100%. Then if a family has genetic metabolic conditions, then we have a 50 and a 25% range that they can qualify at. That goes up to 285 federal poverty level and 385 federal poverty level. We have been talking and would like to change that. But with the pandemic, it kind of put things on kind of a slow move. We had to slow down on some things because we had to help with the pandemic, being public health. But we really are looking at it, changing that and making some changes that would probably go in effect, hopefully next July. So do kind of keep an eye on that to see if there's some changes in the financial criteria. If you think you're right on the cusp, call me. Let's have a discussion. I'm always happy to do that. But I did want to share that with you before I went any further. Okay, Family Advisory Council. Of course, I'm very passionate about this. I helped start this with the person who's leading it now many years ago. And anytime that you're a family member, you're always going to have a passion in what other families are doing and saying and connecting with them. And you just really, that peer support is huge with this group. But we do talk about advocacy training. We do help work with them so they know how to advocate. We do help really build their leadership skills. It's amazing. We have leaders that sit on national boards, that sit on some of the CanCare boards, that cannot sit on a variety of different boards, all to help make sure that the voice of those with special needs and disabilities is heard. So it's really exciting, some of the things that our group have done over the years. They do get conference opportunities that we help support so that they can attend the state and federal conferences. And we also have assistance programs. They assist with the program policies. They helped with us coming up with what we needed for gaps. As I said, they helped with all the strategic planning things. So they've been very instrumental in everything that we've done. And this has given them an opportunity to not only network, but to learn a lot of things that they didn't realize that they didn't know. To share with us things we didn't know so we can share it with more people, because of course we all learn best from each other, right? And they've really made a difference in their communities. It's it's been amazing to watch the FAC growth and development. And you'll see if you go on our website under materials and resources, they have developed they've developed some white papers to share with providers, like, what it's like to communicate with a family that has a child with a disability, like what do they need from a provider and what have they experienced. They've shared what that's like, that financial struggle. So they've shared several different things in white papers that we've taken excerpts from and put together. They've also developed transition booklets to help transition from birth up, of what that needs to look like. So they've developed a lot of material. They've also developed a trauma-informed care flyer. So families have developed a lot of things to help inform parents more. So if you're interested in being a family advisory council member, or you just want to serve on a council on the committee, we have a consumer partnership council as well. If you wanted to, work on that based on women's health or a child's health in general, there's other councils that you can serve on as well. So please let me know if you have any interest. Let Stephanie know, and we'll get you connected with everybody that's heading that now. And those meetings are right now happening virtually because of COVID, but those usually happen on a Saturday. And those usually, I'm wanting to say, are happening every 2 months to a quarter. I'm not sure the for sure schedule at this point, but I can certainly let you know. Next Saturday, this coming Saturday, is the next meeting. And there is an application process, and there's bylaws and everything that I'd be happy to send to you. Okay, so supporting you. This is one of the other programs that KDHE supports, and the special healthcare needs program is one of the programs within the supporting you. And it's strictly about a peer-to-peer support. We know that the best type of support we can get is talking to others who have experienced similar situations. And that's what supporting you is all about. It's a peer-to-peer support program. And we have trained staff to help connect the supporting peers with the connected peers, and really help answer questions that you may have, or just a shoulder to lean on when you want to talk. They have been through training. If they are a supporting peer, they have gone through training in confidentiality, and in how to be active listeners, and how to not tell you what you need to do, but help you figure it out on your own. By just asking the right kinds of open-ended questions. So it's a really great program. I will tell you that we very much need more supporting peers in the program. And this is an online system. So if you would go to supportingyoukansas.org and sign up to be a supporting peer, we would love to have more supporting peers. The training is all online. It takes 45 minutes, but if you would prefer a Zoom type of training, I am happy to do that with you, or the supporting you coordinators can do that with you, either one. But it takes about 45 minutes to do the different training modules. So it's really not anything hard to do. And then you basically just support somebody via phone, email, text message, whatever way you guys feel is the most comfortable. If you feel comfortable doing it in person, we're not going to stop you from that either. But the first connection always happens via phone, so that there's a certain amount of anonymity to begin with, until people feel comfortable. So the commitment when you're a supporting peer is really to make sure that you're reaching out to the connected peer, the peer that wants the support, 3 times within a 6-week period. After that, some families have built lifelong friendships. Sometimes after the 3 conversations, they're done. Sometimes it goes on for a few months. It's kind of whatever you and the connected peer are comfortable with. Or if you want to talk to somebody else, and it doesn't have to be specifically about the child's disability. It could be, my kid's getting ready to go to kindergarten and I am terrified. I don't know what that's going to look like. I want to talk to another parent who's been through that. Or I'm a single mom and I just want to connect with another single mom just for that support of what that's like. Any kind of topic, believe me, we've probably matched it. Sometimes people want multiple topics or multiple things that they want to connect on. And sometimes we can find just the right person for all. And sometimes we'll maybe connect you with a couple people if need be. So please go check it out. I encourage you. We really desperately need supporting peers. If you are willing to help somebody, it really feels good. I've been a supporting peer, and I know how good it helps you feel when you can help somebody else because you've been there and you know what that feels like. So please go sign up. I would love to come in tomorrow and find out that we've got new people signed up for that. It would be well worth your time. So I wanted to also tell you about the Bureau of Family Health programs, because I think it's so important to know here at KDHE, in the Bureau of Family Health, we believe in really working collaboratively. We don't think any one program can do everything on their own. We know that it takes a combination of a lot of programs working together. And so we've really been promoting and working towards this inclusivity of communicating back and forth to make sure that we are supporting a family through the lifespan, that we're not just supporting at one age or one stage of a child's development, but all the way through, and making sure that we are producing in Kansas healthy families, right? Healthy and productive individuals. So in our child and family section, and when you see this list of programs, these are all programs in my section. So we're kind of a big program and we're very busy, but it's wonderful because there's a lot of great collaboration happening. So the maternal child and family, mostly they have grantees that are in health departments across the state, some that are federally qualified health centers, some are other locations, but mostly health departments. And they provide a whole host of services around women, children, youth, and family health. So, you know, they can go there and they can get a well child check or a variety of other services. They can also get home visiting services. If they need to have a home visitor come out, they can learn about breastfeeding. So there's all kinds of different things that they can learn through the maternal child and family health program. The special healthcare needs is the one that we've just been over, so I won't bore you with more of that, but no, I could go on for hours. The infant toddler tiny K program I touched on a little bit when I talked about bridges. Again, that's for that group of kids from birth to 3 who are suspected of having a developmental delay. They can be evaluated through the infant toddler program and then given services with experts in occupational therapy, physical therapy, speech language, social work, nursing. But they can provide a lot of different services for you. Then we also have the pregnancy maintenance program, PMI is what we call it for short, which is for pregnant moms that just need that extra help. So what mom doesn't need help when she's pregnant, right? This is a great way, and they really look very holistic at that mom and what her needs are. And we will be folding into all of these programs, the special healthcare needs, holistic care coordination, in modified forms based on these programs. So this is all going to be happening over the next couple of years. Then we also have the teen pregnancy targeted case management. This is for teen moms. We know that they have different hurdles than other pregnant moms, and we want to make sure that, you know, we're keeping them in school, we're giving them the support that they need, that they have healthy pregnancies, that they know about adoption, that they know, you know, how to care for a child, and they can make wise choices as a parent. So we really want to make sure that we're helping them have a healthy and productive pregnancy. And then the maternal infant early childhood program, we refer to this as MCV. MCV is really a funding source, and it really provides all kinds of services for families that have children birth up to age 5. So a lot of times you'll hear parents as teachers or early Head Start. These are some of those kinds of programs that we provide additional funding so more families can be served. So that's really about a funding source. And they're evidence-based practices that happen with that, or promising practices that are being vetted. And then we also have the family planning. And family planning is about birth spacing, you know, making sure women have their well women checks, you know, that they have their pap smears, that birth control is offered at a cost-effective means, things like that. So it's really important to think about when you're thinking about special healthcare needs. All of these other programs would help and benefit a family with a child with special health care needs. And so it's all about referrals and interlocking as we go about. So I wanted you to know about all of those programs because, you know, like I said, maternal, child, and family, they're starting with the MCH home visiting. And so that's maybe just a couple of visits, but then they can move into, you know, more of those maternal, infant, and early childhood programs to get more home visiting so they can get more help with their parenting skills. So all of these programs, when you look at them, kind of overlap into each other. And then in our section or in our bureau, we also have the screening and surveillance. So that means when your baby's born at birth, their little heel is pricked with that little blood spot. And that's to check to see if they have a metabolic genetic condition. If they do, the newborn screening staff will refer to the special health care needs. So we can go ahead and begin working with those families right away. And that's so important. The earlier the intervention, the better. We know that brain development is so critical, and the younger, the better. And so the newborn screening is really a great program to help get babies off to a good start. We also have a birth defects program here at KDHE as well. And that's getting up and running and more to come, but that will also soon be referring to special healthcare needs too. And then Sound Beginnings is our hearing, newborn screening hearing program. So babies are tested at birth, and if they display any kind of signs of hearing loss, again, that's a referral to our program and an automatic referral to the infant toddler program because that's an automatic qualifier. And then critical congenital heart defect, again, is referred to our program. Babies are tested at birth on that too to see if there is any signs of any kind of complications with the heart. And at that point, we can get services in place right away. So all of that is really exciting to see that collaboration happening between the programs. And then, of course, we are also privileged to have nutrition and WIC services within our bureau. And of course, that's a constant sense of referral with all programs to WIC because, you know, it's really nice for moms to have help with some of those food items, to understand about nutritious foods and that kind of thing. And WIC does a lot around breastfeeding support. So it is another great way that's free to families that families can take advantage. And childcare licensing is another component of our program. And it's really nice for families to be able to find reliable and good childcare. And childcare licensing is where you can go out on their website. You can find out about childcare areas in your region, childcare sites. And so that's another place that we collaborate a lot with and help families connect with quality childcare. Okay. So here is my information. If you have any questions at any time, feel free to email me, feel free to call. I will tell you that I do not work Mondays. Monday is my mental health day that I spend with my granddaughter. So I get to play all day on Mondays so that I have good mental health for the rest of the week. But I do work 4/10, so I'm here Tuesday through Friday. So you can reach me. That way you can reach me. This is my office number listed, but you can also send an email to me and I am happy to respond and answer any questions. Or you can reach me through Stephanie as well. So I am going to open it up. How did I do on time, Stephanie? Am I still okay?
Doing great. We've got
okay. So I'm going to open it up for questions and I'm happy to answer anything. And as I said before, if I don't know, I can certainly find out and get back to you.
So anybody on the call, do you have questions? Feel free to just go ahead and unmute yourself or put them in the chat, either way. Kayzy, while they're thinking about their questions, I've known you for several years now, and I've seen all of this information, but I think it's just like it definitely grows, and it's so exciting to hear more and more or learning more and more about the programs like, the DAPs and other things. The last time I heard this program was probably in March, and I learned that since I work in an autism clinic and, that isn't an automatic qualifier, but I learned that autism and if they receive Social Security is a qualifier now. And I was ecstatic. Over that, because I've been talking about this for years, so I was really excited about that as well. So,
well, they knew when I came on that was I wanted to expand because My son's condition is not one of them that falls into that criteria. And I was like, we just need to expand. And so we are doing it. And it's very exciting because the more families we can help, the better. But we're such a small program that not enough people know about us. So the more that we can get the word out, if I could, I'd have neon signs like Batman that advertises it, but I don't have that ability or that budget. But I'd really like to get the word out because there's so many families out there that we're not helping that we could be. So
Right.
please, if you do nothing else, share about this program with somebody else.
Absolutely. And that's what the whole purpose of tonight was, is getting it, at least getting it recorded so that we can share for several years. Hopefully, you know, when lots more happens to it, we'll redo the recording, but share this. It will be on Facebook, but also if you don't know, we archive all of our sessions on YouTube. And all you have to do is go out to YouTube and search Kansas Lend, L-E-N-D, like you're gonna lend me some money. I used to say cup of sugar, but you know, if you want to lend me some money, that's great too. So you can find it out there. You can share it with families. And again, even if you don't know if that person will qualify, send it to them anyways. Let Kayzy and her team figure out if they qualify or not. I think that's because you don't want to miss somebody just because you assume something.
You'd be amazed how many times people will go to the website and go, oh, I'm not going to qualify. And then when they finally do send something in, they do, and they're like, oh, I didn't know you could, that would work. So yeah, we're very creative in trying to help them qualify. We really make sure that, you know, we try to be thinking about all the other aspects that could help with that. So definitely have them submit, and keep in mind that not everything means financial qualification. It might just be a medical qualification, or it might be like Stephanie was saying, SSI. Or it might be one of those things like the navigation trainings where it's free to everybody. So, you know, keep that in mind too, that it's a very diverse program that has a lot of different components. So we try to make it as friendly as possible.
I also thought a great thing too is thinking about, well, you know, you may not qualify in February or March, but it's October now, and you may have had a lot of, as we've seen over the years with with insurance, the out-of-pocket max continues to grow for families. Yeah. So I'm sure that helps in spending down that money. So
we have a lot of families that we know don't qualify the first 6 months, and then they qualify for the second 6 months, which is a huge benefit to them. So, you know, that happens frequently too. And we're happy to answer questions, work with you. I will mention too, our website is still up and going, but the KDHE website, they're revamping our entire website, and it should be done in January. So if there's any kind of glitches or anything, I don't think that there is, but you will be able to get more information because we'll be putting more out after the new website goes live. But you can go in now and you can look at what we call our decision schema. And Stephanie, if you wouldn't mind sending that out to everybody, if you're sending anything out. But the decision schema is really quick. You just look at it and you can determine, is this a qualifying condition or not? Like it's very quick. You can just look at that scale and you'll know whether the child would qualify medically or not.
So we did have a question in the chat. I have a question regarding system navigation training. Is that training only available to families that currently qualify, or for any family who may need more information or might qualify?
So it's for any family or family member that has a child or a loved one with a disability of any kind. That's the only parameter. So there's no financial, there's no paper, there's nothing. You just have to register when we have the trainings, and we'll get you signed up and going.
Great. Any other questions? Well, I want to thank everybody for attending tonight, and all those watching on Facebook. I appreciate that. Kayzy, I appreciate you coming and bringing so much great knowledge to all the families, whether they're here now or watching later. So I just want to thank you. So everybody have a wonderful evening. Enjoy the weekend, and pray that I get my my voice back at some point. So thanks all.